Hi, everyone. Thank you for joining. I see participants are just coming in, so I'm just going to give it a minute or two, and then we'll get started. Hello. Thank you for joining. I see the number is still climbing for participants, so I'll just give it another minute. Thank you, everyone, so much for coming. All right, we can go ahead and get started. Thank you so much for joining for our learning community event today on applying data-driven approaches to vaccine equity. If we could start the next slide. Just before we jump in, I have a few housekeeping things about the Zoom. So all participants will remain muted throughout the webinar. And there's a question and answer feature in the Zoom taskbar you'll see. If you want to submit a question anytime, you can type it in. There will be questions addressed during the Q&A portion at the end. Also, please avoid posting questions in the chat for the speakers. And just to note, the webinar slides and recording will be shared with the learning community members after the event. So we'll send those out. And if you're having any technical difficulties, please feel free to email us at vaxequitylearning@urban.org. Next slide. So my name is Crystal Ramos. I'm part of the Learning Community team, and I'm so excited to introduce to you our speakers for today. We have joining with us Joynetta Kelly, who is a CDC project officer and from the Disproportionately Affected Adults Populations Racial and Equity Subunit. And we have Joan Enderl, who is the Senior Manager of Public Health at the American Heart Association and Heart Reach El Paso. We have Bernard Macklin, who is the Outreach and Education Coordinator and from the School of Health and Human Services at Southern Connecticut State University. And then we have Mary Greer Simonson, a TA lead for Data Informed Technical Assistance team at Deloitte. Next slide. So as we mentioned, today's event is it's an introduction to applying a data-driven approach to vaccine equity. And as with all of our learning community events, it is open to all of our funded CDC partners in the learning community. But if you are a REACH recipient, you may find the content to be repetitive of what you've already seen. So we just wanted to give you a heads up. So today we will cover introductions, an overview of data-informed technical assistance, vaccine strategy organization highlights, and then these in need report review and example report, and then next steps. So without further ado, I will pass over to Joynetta.
Hi, everyone, and thank you for the introduction. Thank you for the venue to be here today. Sorry, my camera is not on. I have a kid home today due to daycare being shut down. So don't want to surprise anyone with a child running in the background. So thanks for having us again today. I am the one of the project officers currently with the Immunization Services Division at CDC. And we're just really, really excited about being here today. And we hope that this, this webinar, this presentation today gives you the tools that you need to move forward with your work. I hope that it energizes you all to continue the work that you're doing, and we really appreciate it. So just wanted to just talk about the CDC vision, to address and reduce racial and ethnic disparities that exist in vaccination uptake. CDC is building and expanding a network of partnerships and community level action that support racial and ethnic minority communities. And these activities that we're currently engaged in are focused on flu and COVID-19, but the vision is to ensure that these activities, our partners, and our continuous improvement efforts continue to reduce disparities that exist in vaccination uptake long after COVID-19. So this work is going to go on far beyond COVID-19 into adult immunizations overall. Next slide, please. So the question is, what are we doing at the ISD Immunization Services Division? So what we are doing is reflecting on what we know about barriers to vaccine uptake, and especially for racial and ethnic groups experiencing disparities. So some of these are based on 3 different factors, which are confidence, access, and availability. So under confidence, there are some who have anxiety about vaccines, and it could be due to personal experiences, belief systems, or historical trauma that we all have heard about over the past year or so, as we have begun the discussion of vaccinations and medical and government, even distrust in government that a lot of people have. So another part of it is the access. People can't get to healthcare providers, and some can't get to pharmacies or other places providing vaccinations. We hear about food deserts all around, but there are also pharmacy deserts and other things that contribute to access issues. The final point is the availability. Unfortunately, there are doctors or other providers who aren't offering vaccines to some people based on the color of their skin, the culture, or other issues that we probably don't even realize that are still going on in 2021. But they are definitely issues that are occurring right now. So at a high level, the approach that we're taking is multifaceted. We're providing funding and support to various types of partners. We're providing learning and data support to these partners, and also deploying communications and misinformation and disinformation, mitigation efforts. Next slide. So this slide gives you a little snapshot of what we're doing. So we're directly funding dozens of national and state organizations to support and also to fund hundreds of their local and community entities. So as you look here, you'll see the national organizations are on your left and right. So you have organizations like the Conference on National Black Churches and National Council of Negro Women on the left-hand side, who are actually funding their local and their local chapters. Then on the far right, you have other national organizations who are funding community organizations, community-based organizations, local health departments, and community health centers. Then in the middle, we have medical and professional associations whose memberships include thousands of Black, Hispanic, Latinx, and American Indian, Alaska Native healthcare professionals. And then you also have at the bottom, CDC's health equity programs with its dozens of state and local recipients. So also a part of this are the 64 state, territorial, and local immunization programs, which fund county and local health departments, community health centers, and community-based organizations. So overall, that was a lot to say, but we will be working with a network of over 500 entities, and about approximately $150 million has already gone out of the door to fund partners and to support the mission. So we are really excited about this work. We are already working with some of you, and we are just really excited about the future. We know that there's a lot of work to do, and we look forward to continuing this work with you all. So I am going to pass this to MG for the next part of this, and thanks again for having us.
Great, thank you so much, Toinetta. And thank you all for being here today and for joining this presentation. So the next section will be focused on data-informed technical assistance. You go to the next slide. So as new grant recipients, there are a number of resources and information that are available to you to help support data-informed decision making. So on this slide, we've listed a number of these different resources that you can access to gather information, publicly information about COVID-19 vaccinations, racial equity resources, as well as program resources. I'll highlight just a couple of these. The COVID tracker under the first column. So that's where you can find all of the county level data on COVID-19 cases, deaths, and vaccination rates that's provided by the CDC. They also have a number of different information and data files on that can support equity, such as the Social Vulnerability Index, or SVI, information about age, sex, and race. And then also, depending on which state you're operating in, there may be additional publicly available data at a more granular level through your state health department. So definitely check and see what information is available to you in the states where you're operating. I'll also highlight, there's a number of other resources where you can find information about, new strategies, policies, and research about racial equity and COVID. The Kaiser Family Foundation has great resources that you can access. And then finally, I do want to highlight that there's just a number of great resources that will be available to you specifically as a recipient for the Partnering for Vaccine Equity program. So as Crystal referenced at the beginning, the Learning Community website will be up and running soon, and we'll be offering new events and resources, as well as the Materials Hub, where you can access some of the information and examples of materials from other recipients. But the focus of our presentation today is really on this last bullet here, the data-informed technical assistance support and reports. And that's part of the team that I am a part of, and we'll talk a little bit about the types of support you can expect to receive from us. So next slide. So the data-informed technical assistance team provides two types of types of support. We provide data reports, and we also provide technical assistance to recipients. So you will be receiving a data report that is tailored to your specific geographic focus and your priority population. And you will also be participating in a group technical assistance session with your prime organization and the other subrecipients under your prime organization. And at the end of this presentation, we'll do a quick preview of the data report that you all will receive as subrecipients, and some of the information that's included in that report. So on this slide, these are some of the types of analysis that we've provided to the different recipient groups that have participated in the program. So we have a number of different data fields that are available to us at the household level that we can provide to recipients. So some of the common ones here are, places of interest. So, you can see maps of health locations for your specific geographic area. So you can identify some of those hotspots where there might be areas where there's lack of access to health locations, mobile clinics, et cetera. We also have information on race and ethnicity, which of course your reports will be specifically tailored to your priority population that you have selected. And then we also have information about lack of access to vehicles, which you can use to be able to find additional locations where populations may need additional support accessing vaccines, and to inform some of those outreach and engagement efforts. For the first report that the subrecipients will be receiving, that report will focus on multi-generational households and on lack of vehicle access. And those topics were chosen based on the onboarding survey that the prime organizations filled out about what sources of data would be most helpful for the recipients in their decision-making process. And then on this slide, we're talking a little bit about some of the examples of ways that different recipient groups have been using this information to target some of the efforts and their activities for outreach and engagement to their target communities and priority populations. So of course, this is not a comprehensive list, and in our group technical assistance sessions, we can talk specifically about some of the ways that your organizations can tailor these activities based on your priorities and the activities that you have planned for this year. But on the left side, we have some strategies around targeting campaigns for priority populations. So for example, many organizations are working with trusted messengers to share information in their communities. So you can use the maps and data we provide to identify some of those neighborhoods and areas where you have populations who are at risk or who may be more likely to be vaccine hesitant, and then identify some of those organizations that may be good partners for you to conduct additional outreach and engagement in the community. So churches, barbershops, local businesses, all of our recipients have had great success in partnering with all those types of organizations. We also have heard from a number of organizations that are partnering with other events in their communities to reach different populations. So really meeting the community where they are at back to school events, food drives, events that target new mothers or other younger populations. And there are some great opportunities to have partnerships there and bring some of those services together for the community. And then on the access side, there are a number of ways that you can use this data to help inform your activities. You can expand transportation services and routes in areas where there may be a lack of options for the community to access different vaccination sites, and recipients have worked with their local transportation departments to think through some of those issues. And then a number of recipients are also working with organizations like Uber or Lyft or other community organizations to provide free rides to vaccination sites. And using the analysis that you'll receive from the Data Informed Technical Assistance team, you're able to identify some of those neighborhoods where there are not health clinics or there are a number of people who do not have access to vehicles or other transportation options. So find some of those access deserts. And so, we wanted to make sure that you all were able to hear directly from some of the recipients who have been successful in implementing some of these strategies and hearing about how they are using data to inform their activities and really target and reach their priority populations. So we have two spotlight speakers today from the REACH recipients who are going to share a little bit about their stories and some of the strategies that they are implementing to reach their communities. So I'll pass it to Joan now with American Heart Association to hear a little bit more about their outreach strategy.
Well, thank you, MJ, and thank you for the opportunity to share some of the work that we've done with the American Heart Association with the CDC funds for both the flu and COVID, and we appreciate the opportunity to expand our work in REACH in these areas and the positive changes that we've seen and continue to see. So the REACH grant for the American Heart Association is in the El Paso, Texas, the county of El Paso in Texas. And as you can see, our priority population is Hispanic, Latinx, and Black African Americans. And the Hispanic community is about 83% of the total population in El Paso. So it is the majority, and the Black community is about 4%. So with when we talk about data-informed decisions, it really starts with the data. And so I just wanted to share for a few minutes, what types of data we collected when we started. We started with, flu vaccination rates and compared those in El Paso County to the state and national data. We looked at the historical impact of the flu in El Paso. And also then when we switched to COVID, we looked at the impact of COVID, which was pretty significant in El Paso. Talked about those maps. We did looked at the maps of the priority populations and locations and mapped where the current vaccination sites were and where there were gaps. We also did key informant interviews. So we visited with those vaccinators like the Department of Public Health to look at what they saw as barriers and gaps to vaccination in El Paso historically and with the current situation with COVID and flu. We also talked to community leaders and their perceptions of gaps and needs. We also did social media listening, which is a great way to get kind of feedback from the general population, and we work with a communication consultant on that. There also were focus groups that were held that could either confirm or refine our findings. And so from that, we developed our findings to inform our activity. So some of our findings were that in El Paso, children are highly vaccinated. We're above the state and national norms that the culture in El Paso is that vaccinations for children are highly valued, and there's a strong participation in the pediatric vaccination programs. Also among seniors, there was a higher than state and national average for our priority populations, which was great. But when you look at the 18 to 39-year-olds or the other adults, the vaccination rates were very low, much lower than both the state and national. Males even lower than females. And so that led to kind of, well, what were the barriers or what were the reasons for that? Well, El Paso has a very low income, has a high percentage of individuals in low income, people who are employed where they don't have insurance that might cover vaccination rates, so costs. Also, transportation was consistently in all areas of our data collection shown as a barrier. Convenience, many parents or adults work multiple jobs due to the low wages, which then impacts their time commitment. And also communication. Most of the communication is in English, and 60% of Hispanics consider Spanish as their primary language. There's also vaccine hesitancy. As you can imagine, El Paso County, if you're not familiar, is a border county, border with Mexico. And so immigration and concerns with immigration and immigration status also impact individuals' interest or willingness to seek out vaccinations. We also found that was consistent, that perception of that age group found themselves as healthy. So they felt that if they got COVID, that they would be, or the flu, that they wouldn't be that sick. So why get the vaccine? Also, why get the vaccine if you've already had COVID? Because then you're immune, right? Not really, but that's the perception. And also the effectiveness of why get a vaccine if you still could get the flu or you could get the COVID, and that effectiveness rate has impacted. So taking that data, taking those information, that then led to our data-informed activities. So we worked with the city and other vaccinators on looking at where the sites should be located. Of course, all vaccines were free for both the flu and COVID. We were very fortunate to work with the city and county, and they purchased last year 100,000 doses of flu vaccine, so everyone could get it free. Previously, they had only purchased 5,000 vaccinations. So that kind of resolved that issue. But of course, we still had the issue of cost of vaccines, the cost, like cost of time away from work, cost to get there, the transportation. So one of our strategies was to take the vaccine to the people or places they were already going, in addition to working with the vaccinators on increasing the hours. Before we started with our campaign and our collaboration, almost all the vaccine sites operated Monday through Friday, sometime between 8 and 4. So we also so we decided on a high number of mobile clinics, including at the zoo, which was a drive-up event. We worked with the bus system and had flu vaccination weeks at the major transfer stations. We worked with churches, we worked with work sites, and if work sites were willing to vaccinate their employees during their time, that of course helped with those issues. And one of the exciting things, the first things we did is when we met with the city and those people who vaccinate at the schools, remembering that schools were closed at the time, they said they were still going to vaccinate kids at the schools for flu, and had, of course, this 100,000 free vaccines for adults and others. And we said to them, well, how about, would you consider, since the parents have to bring the kids or grandparents, whatever it might be, because lots of multi-generational families, why not vaccinate everybody who comes with that child? So the parents could bring the child, say to the elementary school or the middle school, bring the whole family, and everyone could get vaccinated at one site. And they're like, hey, we never thought about that. That's a great idea. And then when I checked back with them, they said, you know, we liked your idea so well, we decided that we would vaccinate anyone in the neighborhood, whether they had kids at that school or not. And that was really highly successful, and now is going to be implemented in the schools where the kids are 12 and older for COVID as availability. Of course, even though there was a pandemic, people were still doing some shopping at the shopping centers. So we worked with the major outlet mall, and they were willing to give us give the city vaccination program a free site or building so that they could do flu vaccinations while people were shopping. Again, bringing the vaccine to the people, convenience, evenings, weekends. And then, of course, I mentioned the issue with the language and the Spanish. And so we did a heavy communication and marketing campaign in collaboration with the city for the flu, and now with the El Paso COVID Collaborative, where we have messages in Spanish. And as mentioned, we work with promotoras, and the mapping also helped us determine where to send the promotoras, where the areas are that had the lower vaccination rates. Our city partners shared the mapping that was done with the city council and the city commissioners and the county commissioners, and they were so impressed with our strategy that was developed from using the different mapping that they actually funded for the COVID campaign some data collection. So now for COVID, we actually have maps that show us how many individuals in each of the zip codes in El Paso County have been vaccinated, and we have both percentage and numbers, which again help us inform where we prioritize our efforts, whether it's the communication, the mobile clinics, and such. So as you can see, one of our partners or collaboratives is the Reduce the Risk campaign. This is part of the El Paso Collaborative. And again, trying to reach that 18 to 40-year-old group. We worked with 2 sports teams in El Paso. We have, El Paso has a semi-pro baseball team whose Chico is the mascot. And then there's also a pro soccer team that has a mascot. And so what I wanted to do today was just show you a promotional video that runs on social media. It also is shown at the during the games to increase individuals to vaccinate. And just one more point, our thought is we were going to actually look at offering vaccines at the baseball games, and a second round of focus groups, we talked to them or asked them, would they get vaccinated at an event? Because El Paso, now that it's more open due to the pandemic, is very much a get together, celebrate, lots of events. And people said, no, we don't want to get vaccinated at an event. We want to get vaccinated at somewhere, either at a physician clinic or a mobile unit that's in our area. When we go to an event like a baseball game, we want to just enjoy. But this has been very well received and has helped encourage people to get vaccinated. So here's Chico.
After over a year that kept us apart, all Texans over 16 are now eligible to get vaccinated against COVID-19.
Great job, Chico. You're a good boy.
As more of us get vaccinated, we can get back to more of the things we love, like cookouts, family road trips, dinner at grandma's, and best of all, Chihuahuas games.
Getting vaccinated increases the things that we can do together because it reduces the risk for you and for me. Get ready, get set, vaccinate.
Near the fence, it is gone.
Awesome. Love that video. It's so great to see the community engagement. I see that we do have a question here, Joan, for you. Can you share how your organization, how they approach influential messengers to get them on board, and if that included any incentives?
Okay, so yes, we did have approximately, for the flu campaign, 24 influential messengers, and we did do training for them. And we also send them regular messages that they can send out throughout their network. So whether it was church or a community member or barber, or we had a wide range. We do not provide any incentives other than the promotoras, which this may sound odd, but we consider them a community influencer. But we do provide them gift cards for participation in activities. So they do, promotoras are reimbursed through a gift card program for work that they do, like attending community events or doing door-to-door, those types of things. Our other influential messengers, which, like I said, include a variety of individuals throughout the community, we do not provide any incentive. They do that, physicians, whoever they may be, we do not provide any incentives. They do it as part of our mission or support of our mission. From the social influencer side, we have worked with two groups, and we have provided small reimbursements. So we have like Moms on Board, which is one of the groups, and they do some promotion for us. And we purchased a package that was $360 total. And then we have Annie's Adventures, and Annie's Adventures is kind of someone who goes out and goes to events or activities and talks about them. And that charge was like $250. Otherwise, we do not do any reimbursements or incentives other than those two things. Generally, people want to participate with us because we can provide things like for the churches. They wanted to work with us because they want to get people in the pews. And we provide them with messaging, we provide them with printed materials and that type of thing, or social media type messages.
Great, thank you, Joan. Any other questions or comments for Joan? I'm sure many of you have, professional or semi-professional organizations in your areas as well. So a great opportunity for some partnership and education events with those sporting events, especially to reach the younger population. All right. Well, thank you so much, Joan. We really appreciate you sharing today. So if we go on to the next example, unfortunately, our second panelist, Bernard, had a family emergency and is not able to join today, but I'll just provide, a quick overview of some of the strategies he was hoping to share with this group. Southern Connecticut State University is a partnership with the Yale School of Public Health, and they established the Community Alliance for Research and Engagement, and they operate primarily in New Haven. And over the past year, they've been implementing education campaigns, outreach strategies, and also working with the community to place mobile and walk-in vaccination clinics across the city. So one thing that they particularly wanted to highlight was their recent Boots on the Ground campaign, which is a community level campaign that features a number of different outreach and education activities, as well as those mobile and walk-in vaccination sites. And what Southern Connecticut did to inform this campaign is they held a series of focus groups and talked to members of the community to better understand some of the hesitancy issues, potential access issues, and be able to really understand what kind of messaging would resonate with those populations. And they also used some of the data and information they had about the at-risk communities, where the Black and African American and Latino communities resided in New Haven that they were trying to reach. So if you go to the next slide, we just have examples here of some of the types of materials that they've developed for their Boots on the Ground campaign. And you can see, on the left, a recent health fair event that features a number of, health screenings, information, resources, but also, like we discussed at the beginning, incorporating some of those, fun elements and other services like food and music to really draw people out. And then also on the right, one of the things that they heard from this campaign was that it was important to develop materials that were specifically targeted for a certain population. And so for, in the case of the Latino population, for this campaign, they developed all of these materials in Spanish first. And so oftentimes in the past, materials and marketing campaigns had been developed in English first and then translated to Spanish. And sometimes some of that messaging doesn't translate as well, or some of the talking points aren't targeted to the specific population. So for this campaign, they started with the target population. They started in Spanish and made sure that all of the materials were really targeted and tailored to that priority population. So if you have any questions, I will absolutely do my best to answer them, and we'll certainly try to get Bernard on for the next event. And I also see in the chat here, if you do have questions, please enter them, just type them into the chat, and we'll try to cover them throughout the presentation as we go. All right. So in the next section, as promised, we wanted to provide you all with a preview of the Communities in Need report that you will all be receiving as a subrecipient organization, and do just a quick walkthrough of that information so you can know what to expect, and then talk through what the next steps will be for those group technical assistance sessions. Great. Go to the next slide. So these Communities in Needs report that you will receive, as I mentioned at the beginning, these reports will be tailored specifically to your geographic area and your priority population. And you should have submitted those priority areas and geographic areas, I believe, with your prime organization, and also have confirmed them with the program. And so, definitely encourage you to make sure that that information is correct, so we're able to produce the most relevant information for you. So these reports will include a few summary statistics about COVID-19 for your area. And then, as I mentioned, we include 2 analyses, the multi-generational households and the vaccine access challenges for each organization for your area. If we skip over to the next slide, so some of the factors that we focus on in these reports are race and ethnicity, the multi-generational households. We also look at low-income populations and the vehicle access as well. And as we discussed at the beginning, there are a number of different data fields that we can include in the future for future reports. So these just give you a feel for what you can expect from analysis, and then in our sessions we'll just discuss more specifically for your organizations and in your primes what would make sense. All right, so this overview slide just provides some general statistics about COVID cases and vaccination rates in your state, and highlighting your specific county or your geographic focus. And then we also include information at the bottom about other funded partners in your area. So we get this question a lot of, are there other funded grant recipients that organizations can be working with or partnering with to reach communities in neighboring areas? And so include that information as well, so you can consider partnerships with those organizations. And then for each of the two analyses, we provide maps which highlight the top 10 census tracts where you will find the priority population included in the analysis. For this view, we're looking specifically at multi-generational households. So that's households where there's an older adult, a grandparent, or adult over 65, as well as a child under 18. So, those are important households to consider targeting, both because they have that younger school age child that might be, going back to school, be more exposed, and also have some older adults who may be at risk. And so for each analysis, we provide those top 10 census tracts, and then on the following slides, we zoom in on those census tracts so you can see at that street level where those hotspot locations are and the zip codes that align to the top 10 census tracts. So we'll include this information in your report, and we'll also include the same information for the access challenges. And for these access challenges, you'll notice that we also include the health locations on the map. So you'll see in the little triangles in your reports the FQHCs, hospitals, pharmacies, and urgent care centers. So you can identify some of those areas where your populations may have issues accessing a vaccine, either for COVID-19 or for flu vaccinations as well. And this is the same general view as the previous analysis, but instead here targeting this new priority population and also including the health locations. So as we mentioned, we're in the process of developing these reports for all of the new grantees, and you'll be receiving that in the coming weeks. We'll be working with your prime organization to coordinate the distribution of those reports to you, and to also schedule your first group technical assistance session. And in that session, we'll recap the data analysis reports, walk you through the information that you're provided, and answer any questions. And then the majority of the time will really be spent diving in with you and your organizations and talking through how you can use that data to inform some of your activities, and think about which potential vaccine strategies you can implement or further target to really increase equity in your communities and among your priority populations. In these sessions, we'll also discuss potential topics for future analysis for your organizations, and talk through some of those other options for reports and what data would be most helpful for you. So, we're really looking forward to meeting with all of you in those group TA sessions, and you can look forward to receiving those reports soon, and we'll be coordinating with your prime organizations for that. In the meantime, you're welcome to follow up with us via email. You can flip to the contact slide. The data-informed technical assistance team, you can see our email there on the right. And of course, the other organizations that are here to support you, the group learning support, as well as the materials hub. So lots of great contact information here. And we will be sharing these slides, so you'll have access to the resources included here and all of the contact information as well. So I think that it concludes today's session. You know, we'll stick around for a couple of minutes. If anyone has any additional questions, we're happy to answer them. But we thank you all for joining today and look forward to continuing to work with you and support all of the great work you're doing on the ground. All right, let's see. Looks like we do have some questions in the chat. Yes, so the reports will be distributed through your Prime organization. So we'll be in contact with them to receive your email addresses and distribute those. The data is aggregated typically at the county level, and we will share information based on the census tracts and zip codes within the counties that you've expressed as your geographic focus areas. If you want to update your geographic areas or your priority populations, you can reach out to your Prime organization and make sure that those are documented, as we're currently working with to validate all of that information. There is currently not information available across the country publicly for race information at that census tract level. There is some information at the county level based on your state, and we can talk with you during your group TA sessions about potentially incorporating that information if it's of interest to you. Great. I think that covered most of those questions. And if you have additional questions, please or we didn't get to yours, please feel free to follow up via email. And we're happy to answer those or schedule time with you to discuss. All right. Thank you so much, and appreciate your time today. Have a great day.